Hello and welcome to this week's episode of the Treat Your Business podcast. Super excited for this conversation today because we are continuing on from a couple of episodes that we have already recorded around the change to, patient behaviour and what patients are wanting more of now in terms of their rehabilitation and their care. And perhaps this is a kind of fallout of the pandemic and trust issues and people wanting to ask more questions and avoid being in hospital. But this episode is a little bit different from normal strict business advice, but it's really about us leaning into what's changing in the industry, the exciting changes in medical technology, what is being taught at university, and I guess what our graduates and our newly qualified that are coming through are going to be expecting perhaps of us within our clinics. So pull up a chair, grab a cup of tea, and enjoy this episode. Welcome to the Treat Your Business podcast, the show for clinic owners who want real, honest advice and tried and tested ways of doing things. I'm Katie Bell, and this is the new era of bigger insights and bolder conversations to help you grow a clinic and a life you love. Let's dive in. Hello, ladies. Welcome back to the Treat Your Business podcast.
Thanks for having us again, Katie.
Thank you for being here and for having the opportunity to continue our conversation. Now, we recorded a podcast a few months ago now, and if you haven't listened to that one, I would encourage all of you listeners to go back and listen to that. I think it was a great introduction into MBST. Dr. Annie, you provided your wealth of knowledge within a very short space of time, which was great. So I would encourage people to go back and listen to that. So Liz and Dr. Anna, thank you again for being here. I know we want to talk about the kind of evolution of MBST and what's about to happen in terms of its expansion and things that are going on across the world, but also in the UK. So Dr. Anna, do you want to explain what is happening behind the scenes? What can we all be excited about?
Yeah, thank you so much, Katie. Thanks again for having us here. It's always such a pleasure to talk about MBST and spread the word. So yeah, actually, it's quite exciting times for MBST. So we are now partnering up with new countries. We're diving into emerging markets. So I've just recently been to Singapore and India. So we have now opened up centers in Mexico and Honduras, for example. We are exploring South American options and Southeast Asia. We've been talking to experienced users, rheumatologists, and a clinic, met with new possible partners. Same for Indonesia, Malaysia, which has just started. Also, Vietnam is a very promising country with strong interest in advancing combination therapy. And in India, interestingly, we talk to, let's say, major hospital groups. So it's a big market with a huge need for conservative treatment. And this also allows us for doing great studies there. But yeah, so this is, I think, has been a growth for our company up to 30% last year. And also when I attend all those conferences and talk to more and more healthcare practitioners and colleagues about MBST, there's really raising more and more awareness for conservative treatment options, for being able to think outside the box and think about which kind of things in my toolbox might be still needed. So perhaps we can talk a little bit later about those regenerative medicine. And it's such a promising future for medicine in general, or therapy, or this kind of new therapeutic approach. And I think we're quite proud to contribute with MBST to the journey. But I think especially for the UK, it's really, it has been a fascinating journey so far. It's quite good to see in which direction we are moving.
It's to say that patient demand, even for MBST, from the start of January to today, our patient numbers have gone up 44% from last year. So even just people recognizing or the need, or more and more patients, which is huge, 44% from this time last year. And we're opening, we've finally employed a salesperson as well. We've never had a sales department. So yay, we need one. So yes, anyone inquired about an MBST machine now, you actually get looked up. No, I'm really joking. Of course, you always get looked at. We actually can deal with the inquiries now because last year was just off the scale. But yeah, so back to Anna, taking it back. It really is an exciting time. And there's so much coming. And Anna's going to tell you more about it now. But I just had to tell you how great it's going in the UK right now since the beginning of January.
Yeah, that's so exciting. This is this funny principle that I call traction, where in a business where you feel like you're doing all the legwork for so long, and then all of a sudden something feels like it clicks, and it isn't anything that clicks. It's just that you have banged the drum for long enough and you've got that kind of level of visibility, and people are now talking about it, which, you know, a year ago, people perhaps were talking about it less. It's really exciting, isn't it, for you? So, Dr. Anna, tell us some more.
Well, you said something like now it seems to set off or seems to speed up, etc. So this also fully aligns with, let's say, my German or international or UK experience. And I think what I learned from my last business trips, which really led me to different kind of countries, is that kind of agreement or, let's say, finding that the majority of all patients really wants to avoid surgery. So this is quite encouraging that we can now present something or have some kind of the missing piece in the toolbox that helps addressing that kind of need. I mean, MSK also from a socioeconomic standpoint is such a huge burden. I mean, like osteoporosis, osteoarthritis, chronic low back pain. And what we have in our toolbox so far is okay, moderate, perhaps good, but still there is this treatment gap. And wherever I come to, whomever I talk to, it's always this perception of, yes, we need more to help patients who want to avoid surgery or want to overbridge or gap time between surgery or offer them something in between and to address that treatment gap, but also have something in your pocket to answer that kind of need. So, and especially when also exploring other markets, they are quite open to what we call regenerative medicine. It's some kind of a, let's say, emerging term which says in orthopedics or refers to treatment that aims to repair or regenerate damaged musculoskeletal tissues by stimulating the body's own healing processes, rather than really just relieving symptoms or just replacing tissues with artificial implants. I mean, in many cases, it's needed at some point, but it's really the kind of last resort, and we have to offer patients more than just those kind of definitive, let's say, solutions. So when it comes
And
to
with great technology, sorry, Anna, but already, you know, things like EMTT, shockwave, laser, they're already used in clinics. So it's just showing that medical technologies are being used more and more. And I'm hearing that a lot of physiotherapists coming through medical school, university, that they're coming through are being taught more about these technologies. And with UEL, actually, MBST is going to be a module there as part of a bigger, even bigger like data collect. But I think Anna, this is going to be part of what she's going to be sharing with you very soon, is exactly how we're positioning alongside MBST with these other technologies, why it stands out, et cetera, et cetera. There's a lot of studies happening, isn't there, Anna?
Yeah, absolutely. And I think just mentioning the neighborhood health app at UEL just shows also the massive need for education. And I can tell from my background, when I was still focusing mainly on surgery, that for me back then, conservative treatment just comprised some sessions of physiotherapy, ibuprofen, and that's it. And now I've learned more about all those kind of approaches in my time in the industry and like talking to so many healthcare practitioners worldwide. So I think our goal is obviously spreading the word about this kind of therapy. But for me, it's also a really big thing, heartfelt, to spread the word about those kind of options to treat patients in a non-invasive way, which is not harmful with non side effects. So this is really, for me, as I still do lecturing at my university, a big educational purpose as well. And this is also one of the main focuses with UEL. So it's about providing access to this kind of cutting edge science to staff, students, and the neighborhood, obviously, but also educate students and the neighborhood about what kind of options do they have as patients. It's not just this easy fix thing. So they also should know or be educated about this kind of toolbox. And so that's why I like regenerative medicine or the idea a lot, because it does comprise a great toolbox. And like I said, many practitioners already have some kind of very good things in the toolbox, but still feel, okay, there might be some kind of a missing thing. And that's why where MBST fits in quite well, because it tackles those kind of, let's say, smaller or bigger deficits other modalities might have. So with a laser, for example, you cannot reach all kind of penetrate all layers of the body. With shockwave, you're limited to, let's say, certain anatomic regions. You're not allowed to do it, let's say, everywhere in the cervical region. You cannot reach any kind of, let's say, deep down structures or go transabdominal, etc. So MBST fits in quite well because it can really penetrate all tissues. It reaches all possible structures or layers within the body, and it allows even for a whole body treatment. So many devices usually are limited to smaller areas of treatment. And with MBST, depending on the device, you can even address or tackle, let's say, systemic problems like osteoporosis, polyneuropathy, poly-OA, etc. So, and you can always start with MBST because it's pain-free. And this actually complements quite well your toolbox, which you already have, because many say, okay, well, laser does quite a lot of good things, but the problem is that it's limited to, let's say, the upper or superficial layers. And interestingly, as I said, we are, let's say, expanding as a company, but also with regards to research collaborations and scientific collaborations. We also now collaborate with a University of Munich, a very renowned scientist in the world of shockwave and laser. And he dived quite deep into all kind of available preclinical and clinical data and analyzed what does laser do. And interestingly, when it comes to putting all those kind of, let's say, findings together, you can see there are quite interesting similarities. So between magnetic resonance therapy and also laser therapy. So functionally, magnetic resonance seems to correspond to photobiomodulation, which laser does, with effects comparable to those of laser, but it overcomes its significant limitations through effective stimulation of even deep tissue structures. And so we know about like the effects or mechanisms of energy redox and inflammation regulation, but this kind of, let's say, idea or new perspective or angle probably makes it easier to understand for many practitioners why MBST works within so many issues or conditions and in which not, because we now really can understand, let's say, stepwise better and better the complex world of magnetic resonance therapy. So yeah, you can easily access our preprint by Professor Smits and others. I think we can probably share the link in the show notes, or it's also on our LinkedIn. So for the ones who want to dive deep into the scientific background. But I think the bigger picture when it comes to regenerative medicine also comprises, let's say, orthobiologics, which is, I mean, interesting because they also try to stimulate health in a more natural way. So many patients probably heard about PRP, BMAC, adipose-derived cell therapy, etc. They are, I think, quite interesting approaches, but especially stem cell treatments, the majority is not FDA approved, and a lot of those things remain investigational and has got moderate evidence and also side effects. So I always like to, before I talk about MBST or let's say any other kind of modalities, and to go one step back and think about where's the difference between a pharmaceutical approach, a surgical approach, and a physical approach. And once you understand the difference of those kind of approaches, you really get a better feeling for which kind of components should be in your toolbox and why this or that does this or that. So pharmaceuticals really change biology chemically. It interferes with the body's processes quite selective. You block receptors, interfere with cascades. So that's why you have got side effects and those polypharmacy issues. Surgery obviously changes anatomy mechanically, so it fixes those aspects, yet it's also associated with inflammation, tissue damage, it's invasive, has got side effects. It's just a structural intervention, but I always say our body is quite intelligent. It always aims for homeostasis. So wouldn't it be better to support and enhance this kind of inherent capacity, structures, and processes? So some modern drugs and orthobiologics try to do that, but unlike medications or surgery, physical therapy actually works by stimulating biological adaptation or modulation through mechanical and biophysical stimuli. So this is a totally different kind of approach. And once you understand that kind of mode of action, and within this kind of family of physical therapies, MBST belongs to, and I think in the future, also when we have done more and more studies, will play an even greater role or more important role.
I think it's fascinating how the behaviour of society has shifted. And I think only this morning, my mum arrived to look after my little boy while I'm working today. And she was telling me about the measles outbreak in London. That's a big thing at the moment. And it's because the rate of vaccination has reduced hugely in children. And this is a throwback from the pandemic and trust issues. And the reason I tell you this is because I think as a society, our behaviour now is based on what we've all experienced 5 or 6 years ago. We are questioning things more. We aren't following the norm of, well, let's just have surgery or let's just take these drugs. We're now saying, well, is there a different approach? Is there something better? Is there something more holistic, that works for me, rather than just accepting this is the way we have always done things. You take some drugs, you reduce your pain, and we see how long we can last before you basically need a new replacement, or you need surgery of something, but that comes with huge risks. People don't want to be in hospital, because of everything else that's going on within hospitals and all the other infections and things. So it feels like society's behaviour in terms of how they want to be treated and what they're looking for now to solve their problem has shifted. And I guess that's why we're probably now seeing, Liz, this huge 44% increase, in patient numbers.
Absolutely. And I think building the awareness as well, we're trying to, our social media's changed a bit, much more sports focused because we're getting more sports data. And I think if you're on Instagram, it's more the sporty sort of people are on there. So we found like an uplift even from people following us and interacting with us has changed. So we're trying to be a bit more tactful in how we do word of mouth. But what I really think is going to be the big game changer for the UK and its people is the project we've got at the University of East London. I don't know how much we spoke about it in our previous conversation, but we touched on it earlier about becoming a module for one of the physios. But what's the most greatest thing? We're part of their neighbourhood health hub. And that is making healthcare accessible to the community in a certain place of East London, Newham. And with that, we'll be giving free access to MBST with those people in those postcodes. So we can treat a number of people that wouldn't normally be able to afford the technology. And Anna is doing an incredible job with the team there in order to create the study protocols. And the information we're gathering, we're also then going to be doing it throughout all our current clinics as well. So we've got this huge data drive coming. So we can further and further spread the word and influence the right people. So Wes Streeting, when he met the technology in October, was just really quite overwhelmed by it to the point he changed his speech last minute to talk about, not necessarily name MBST because it's not allowed, but talk about what the tech machines they've seen. And he said, wow, what this could do, getting Britain back working, a solution for bone health that doesn't mean, things too costly. So we've got the great sports stuff. We've got the sports studies are going to be coming out soon. We've got Liverpool Football Club, Bath Rugby, Charlton Athletic, Wrexham Football Club. They're all working hard, getting all this data to us. But I think this community project showing what we can do, not just for those at the moment because it's private care, but what it can do for everybody from all walks of life is what's really important to us. And yes, fair enough, it probably will be in private health for quite a while, but, and where will it end up going? We don't know, but it's just about building the recognition, the trust that this technology is the future.
Yeah, I strongly believe it is. And I think, interesting, I was with some patients of mine who have been patients of mine for years yesterday, and they wanted to meet my little boy. So I drove out to see them. It was ever so cute. And I was telling them about MBST. He's got osteoarthritic knees. She's got osteoarthritic hip. And I was explaining, in my terms to it. And they were just blown away by the conversation that I was having, because they have invested in me for 15 years to try and keep them away from surgery. And everything that we have done has had a great impact on them. But they're aging, they're, thinking, how long is this? And there's always been this kind of tool in the toolbox for me. I was explaining to them, Anna, you used the exact words that I felt has always been missing. Yeah. Acupuncture, we're getting to do some strengthening work. I'm trying to do all of these different things, but ultimately, am I making any difference at cell level? No, I'm not. Whereas, the introduction of this technology, it just changes the landscape completely.
And that's MBST couldn't work without great practitioners like yourself, like identifying how to work with it. That's what's the important process. Like, yes, MBST can identify the tissue and structurally do that at cell level, but it still needs, one of our physios, he always says, it's like, just think of it, MBST is the ingredient and the healthcare professional shows the body how to use it. And it's the best way of putting it.
Nice. Yeah. It doesn't replace everything else, does it? It all still has a place, and we're seeing more and more push into rehab and exercise-based prescription and all have their place in some respects. But this is about, I guess, for me, a kind of a deeper level of care, a more, it is really a deeper level of care for our patients, isn't it?
It is. And I think this is also why we get not tired of saying health starts in the cell, because this kind of technology actually allows for really targeting the root cause, targeting cellular health, going down to that kind of, let's say, not only deep level regarding, let's say, anatomic structures, but really addressing those various processes, metabolistic aspects, etc., which can be stimulated in a very sustainable way. So that's why we do not say throw away the rest of your toolbox. No, it's really complementing it quite well. I mean, even when it comes to PEM, for example, this can be considered as MBST little brother. So you can always start with that. It's good for acute symptoms. I had it when I had my ankle sprain, but when I repeated it like 2 or 3 weeks later, it did not show any effect. So you can always start with, let's say, some things, but especially with MBST because it's pain-free. But when it comes to readjusting your cellular clock, etc., and want to have, like you said, those kind of sustainable effects which really affect, let's say, the core of the problem, you now have something you can add on and offer to your patients. So like you said, it's some kind of the missing piece. And interestingly, even lots of our users have made the experience that what they did so far, let's say the standard protocol so far, enhances with MBST. So especially when it comes to shockwave or even laser, they see, well, my shockwave results get better in combination with MBST. And I think we are still in the learning process, also from a research and scientific standpoint. It's so exciting times, I think, also for new knowledge which will come up and new studies which we will do. And when I do, let's say, my bigger lectures and also educate people about physical therapies, and if you look into what's happening in the research world, so many scientists are now interested in what do low magnetic fields do, what does laser, light, etc. do. So they now see, like I said before, that this kind of approach really seems to stimulate the body in a much more natural way and enhances those kind of, let's say, processes towards homeostasis probably much better than, let's say, what we did so far. And so that's the good thing about medicine. It's always evolving. There's always going to be new knowledge which can be incorporated in our daily practice. That's where it's needed. So publications are good, but in the end, our patients need better care and better treatment. And so, yeah, this is why it makes me happy to have something we can offer to, say, achieve more sustainable results, adjust cell health, and be a good partner in a setup and even lead to better results.
I know I keep bringing it back to the sport, but I think, when you look at the medical teams, they have their strict protocols, don't they? They have everything they use day in, day out. And then when they add in MBST, I wish I could share some of the headline data now with you. I don't know, Anne, if you've got any of the Charlton, we could sneak some of it out. But it's weeks and weeks off. And each tissue has its own sort of time frame, which is really interesting. So how much MBST is saving the return to play, getting that player back, if when compared to its data, because you'll never be able to do a placebo-based study with an athlete because they can't afford to do that. But what they can show is throwing everything at the athlete that they normally do, adding MBST in is the only difference within reason, as much as you can control. The significance is weeks off an injury. It's amazing. It truly is.
Well, interestingly, Liz, because I happen to know that MBST is used at Bath. In Bath Rugby Club, isn't it? Yeah.
Yes.
My husband is a huge rugby fan. Like, he knows every player's name. It's like, fantasy football. Rugby is on the television all the time. Okay. He knows everything that you need to know about rugby. He knows it. And he happened to say there was a player in Bath that got injured. I don't even know what injury it was, but it was quite significant. And he was back really quick. And my husband was like, he's back, because I'm always talking about injuries and things. He said he's returned to play, really quickly, which is obviously great for Bath. And I was sat in the kitchen and he was telling me this, and I was like, I wonder if. Well, I said, I just wonder if maybe he's had some MBST thrown at him and the change in that.
It's probably one of our case studies that we can share. It's amazing because we had, what was really lovely for us is that there was a guy, he was meant to be out for so long, but we managed to get him back. And Bath Rugby's amazing rehab team. We can't just take all the credit. He got back that much faster that he got them picked for Wales for the first time. And I think things like that, the knock-on effect that has is what's so huge. And I think there's also one for England as well. And it just makes you feel, oh God, I get emotional. Like it's you're impacting people's lives even from that, you know?
It was exactly that one, Liz, because my husband's so it's this thing about, but you know, that's incredible, isn't it? That, you know, he's smart. He was like, wow, I wonder how, you know, he's you know, returned that. So much so that, you know, the conversation now is, when are you buying one? Like, we need one of these. We need one of these in our house. You know,
and get more rugby players on up there. Like we will be presenting this data. You know, the time is right. We've got enough. We will, and you know, and these healthcare professionals at the clubs are willing and wanting to talk about it more. So it's really great for us. Really is.
Maybe you'll be on the next Wrexham Netflix documentary.
We have. We were on it for about, well, not me personally, but the machine was in it for about 3 seconds. It's not the last season.
What? I really recommend. So this really feels very exciting, and I think I don't know whether I'm wrong in saying this, and forgive me if I am, but I sometimes feel like the UK lags behind in our approach to regenerative medicine and being open to perhaps these technologies. You know, you kind of experience people like going to Spain and Germany, and they seem to have access to much more of this stuff than we do. We're very pharmaceutical led and surgical led in the UK. Maybe this is just an observation of mine and it's completely wrong, but it feels exciting that we are finally in
mindset's changing, for sure.
Yeah, the mindset is changing, and that's an exciting place to be, I'm sure, for both of you.
Amy, is it sad because it might be because of the distrust from conventional medicine? Who knows? Maybe and more technologies like this are being used. You know, there's growth that way. I think both from both sides, it's growing.
Yeah. And I think it's a need from all kind of sides, like patients, but also practitioners. And I think the healthcare system itself in the United States, there's a paper about, or even let's say an approach which is called whole person health, because they've realized that they spend so much money on the healthcare system, and it's similar in Germany, UK, Europe, all over the world, that the return of invest health-wise seems not to be appropriate. So more and more people now see, well, probably we have to adapt the current running system because it does not lead to the results we actually want to have for our patients. So patient-wise, they actually want to avoid any kind of invasive treatments. And I think nowadays more information is available out there. And also the mindset changes more towards health, not just treating symptoms, but the whole longevity discussion is about how can I be healthy longer and not just what do I do once I'm sick. So I think this is some kind of a change of mindset, but also when I look at the medical side, but also like I told you, the research side, there's much more growing interest now in which other kind of approaches are available. And also education-wise at universities, or even during my residency, the main focus was quite, let's say, limited to this one and only approach. But as a good doctor, you have to think about other kind of approaches. You want to have a tailored, a more individual approach to your patient in the end, and not a one-size-fits-all. So it's so much about education, and especially at least speaking for Germany, for example, as a doctor, when you leave the hospital environment and decide to open a practice, there is not much education around telling you which kind of toolbox is good, which kind of elements are quite nice. So you really depend on education, people spreading the word about this or that. And now there's so much more growing evidence in the whole sector of regenerative medicine. There's many interesting congresses and conferences you can attend nowadays. Wisdom and knowledge spreads faster, but you also have to be cautious, obviously, at the same time to check whether evidence is good or not. And we are also working on that because we know cell data is good, clinical data is older, we have to update some things. But yeah, it's also fun because we are growing when it comes to science and knowledge. And that's also exciting for me because it feels like every day I learn more about those kind of approaches and how we can, at the end of the day, transfer it into a clinical practice and help our patients. So it's very exciting.
It's a fulfilling job for you, Dr.
Yeah.
For those listeners who maybe haven't listened to the first episode, I'm going to encourage you to go back and listen to that again. I also interviewed two fabulous gentlemen on another episode, which was great fun, and they are using it within their clinics, and we had some really great conversations about how it actually works in your clinic, and really got into the nitty-gritty there. So I'd encourage you to go back and listen to that episode as well. Dr. Anna, Liz, if people are kind of wanting to explore this further, what do they do next? Where do they go?
Yeah, I would come and find us on LinkedIn, Liz, Clare, and Anna Schreiner. We're doing a lot more webinars. Anna's actually got her first one this Friday, but probably by the time this is out, we've got, but there will be more and more, because it's all about education now and focus and releasing data as and when. So because I'm actually using my LinkedIn a lot more myself. So we're just trying to keep everyone up to date. And actually it is such a good tool. It really is quite impactful. And yeah, so come find us on LinkedIn. We've got at MBST UK on all our social medias. But I think from us to our other healthcare professionals, LinkedIn is the tool at the moment for all our conversations like that. All our social media tends to be more for the patient.
Yeah, great. Yeah. Okay, amazing. Well, I encourage you, if you are even just that interested or curious to understand a little bit more, to reach out to Dr. Anna and to Liz on LinkedIn. Thank you, ladies, for giving up your very valuable time to come on the Treat Your Business podcast and just to kind of inspire our listeners to think outside the box a little bit more and be excited about what the future holds.
Yeah, all conversations are always welcome.
Thanks for listening to the Treat Your Business podcast. Hit subscribe now and keep joining me for bigger insights, bolder conversations to help you build a clinic and a life you love.